This is a Bhekisisa podcast.
And so their hospitals are full of unvaccinated people, their ICUs are full of unvaccinated people. And I think there you get a much truer sense of the difference that vaccination makes just because they have such a high rate of vaccination.
Hello, I'm Mia Malan, and this is our first Bhekisisa podcast for 2022. We'll be doing podcasts throughout the year, and not really at specific times, but as issues arise that we think can be broken down in a podcast in a sort of easy to understand kind of way. Now, one such issue that was raised on Twitter many times over the past 2 weeks is how to interpret COVID hospitalization figures within the context of vaccinations. Figures from the National Institute for Communicable Diseases show that more than 80% of people who ended up in hospital during our Omicron COVID wave, especially those who needed oxygen or ventilation, were unvaccinated. But is that not to be expected when only just over a quarter of South Africa's population has been vaccinated? In other words, would you not expect most people falling seriously ill with COVID to be unvaccinated in any case, because there are more unvaccinated than vaccinated people in the country? Dr. Waasila Jassat from the NICD is really great with explaining something like this and to also tell us how these figures are collected. Dr. Jassat heads up our country's COVID-19 hospital surveillance system, which is called DATCOV in short, and she's also a public health medicine specialist. I spoke to her on the phone and started off by asking her what the NICD's figures really can tell us about how effective vaccines are.
First, we need to understand where this data is coming from. We are looking at our DATCOV National Hospital Surveillance, where we have some self-reported vaccine status data. So this is not complete data. We only have data for about a third of patients, and that's because we haven't linked our hospital database to the EBDS. It's difficult using our data to answer these questions. I think it's much better to use Discovery's data or the Western Cape data because they have vaccine status for all their patients. So while it's true that the vast majority of admissions during the Omicron wave were in unvaccinated people, I know the argument might be from some people that most people in the country are unvaccinated. But I think if you look at the data coming out of Discovery Health and the data from the Western Cape, it's quite conclusive that vaccines do protect against hospitalization and severe disease. The Western Cape data show that amongst those who were vaccinated, there was a 66% lower risk of severe disease. The Discovery data has shown that the vaccine has protected their vaccinated members 79% against infection, 92% reduced risk of admission to hospital, and 94% reduced risk of dying. And so those are quite conclusive data from South Africa showing that, amongst those who were vaccinated, they had a huge protection against hospitalization, severe disease, and death.
So is the difference between your NIC data and the Discovery and Western Cape data that in those cases they compared an unvaccinated group with a vaccinated group?
Exactly. I think that's the only way you can answer questions about does the vaccine work. You have to do a proper comparison of vaccinated versus unvaccinated, which they can do because they've got the vaccine status of all their members in the case of Discovery and of all their population in the case of Western Cape. Now, DATCOV just knows how many people were admitted to hospital. So we don't know how many people out there were not admitted to hospital and were vaccinated and unvaccinated. If we had that data, we'd be able to do much better analysis around vaccine protection.
Just to get back to the data that you're referring to, the DATCOV data, can you just explain what is DATCOV and where do you get that data from?
DATCOV is a national hospital surveillance system for COVID-19 admissions that was set up in March 2020. We get data from all public and private hospitals on any patient that was admitted with COVID-19. We get data around their age, sex, what medical comorbidities they might have, and their outcomes. We also get some data on vaccination status, but it's incomplete and quite limited because we rely on the hospitals collecting and reporting the patient's self-reported vaccination status.
So why is the data so low? I understand that you rely on the hospitals to give you the data, but why don't the hospitals get all the data?
Ideally, what we would want is for the EVDS to be linked to DATGov, because then we would be able to objectively say which of the hospital admissions were vaccinated and which weren't, and we could do a lot more analysis around the risk factors for severe disease and death. But unfortunately, we haven't been successful in obtaining the EVDS data for linkage. So we rely on the hospitals, and some hospitals just don't collect that data when they admit the patient. Some don't submit it on DATGov. So that's just unfortunate. We can't control the quality and completeness of the data that's submitted to us.
During Omicron, we've heard that there have been a lot of incidental admissions. So people who go to the hospital for another disease and then they have to test to get admission and then they test positive for COVID. So has that figures not influenced how many hospitalizations we've had and also how many unvaccinated hospitalizations?
So I think it has influenced the data in the fourth wave because we just had huge numbers of admissions. We just had admissions in people who were not sick with COVID. They didn't have COVID pneumonia, they didn't need oxygen or ventilation. So that does explain the higher rate of infection, particularly in children, where we found a much higher rate of admissions in this fourth wave.
Do we see similar trends in other countries where children have been vaccinated, but there's a lower rate than adults? Do we also see more children being admitted?
I just saw a report this week from the UK, from Public Health England, and in their Omicron-dominated wave, they are seeing a higher proportion of admissions in children, particularly young children, but also seeing less severe disease. They're finding similar to what we found in the early part of the wave, and I don't think we quite understand it. Why are we seeing so many admissions in young children who don't appear to have very severe disease, but do require to be hospitalized? So I think we still need to try and understand, is this Omicron that has some affinity, particularly for children, or is it related to the lower vaccination coverage and prior immunity that children have?
If we then conclude and look at data from other countries, I had a look at UK data, for instance, also ICU data, and even there where the majority of the population is vaccinated, the ICU admissions for unvaccinated people, as you've mentioned in South Africa, is still much higher than for vaccinated people, even though their proportion of the population who is unvaccinated is much smaller than the vaccinated population. What does that tell us?
All the countries with good vaccination programs are really calling this a pandemic of the unvaccinated. And so their hospitals are full of unvaccinated people, their ICUs are full of unvaccinated people. And I think there you get a much truer sense of the difference that vaccination makes, just because they have such a high rate of vaccination, and that you can more clearly see that those who do get admitted to hospital, those who do die, are largely those who are unvaccinated. I think they have good booster programs already rolled out. And so many of those who are vaccinated may have already had booster doses. In Israel, already a fourth dose of vaccine is being given. Now, in South Africa, when we talk about the risk in unvaccinated and vaccinated, we're sometimes talking about vaccinated people who received their vaccine many months ago. So they really can't be compared with someone who's received a vaccine just about a month or two ago. And remember that our healthcare workers started getting their vaccines almost a year ago. And if they haven't come in for their booster dose under the Sisonke program, then I don't even think you could call them fully vaccinated because they've been vaccinated so long ago. The same as people over 60. Many of them started getting their vaccines in May, and that's well over 6 or 7 months ago. And we would expect that some of the protection would be waning by now. And so I think it does get a bit complicated when we start comparing vaccinated and unvaccinated, because even amongst those who are vaccinated, there are those who are likely in need of a booster dose. When they are admitted to hospital, it's not fair to say that the vaccine didn't work. I think what's more fair to say is that the vaccine was given a while ago and that they probably needed a boosted vaccine, and the protection probably has waned over 6 or 7 months, and that might explain their being hospitalized.
So the interesting thing that I find is that in a country like, say, the US or the UK, it's even though they have a much larger proportion of their populations vaccinated and also who have had booster doses, their hospital systems still seem to be more overwhelmed than ours. Why is that?
Remember, their Omicron wave started on the back of a very large Delta wave. Our Delta wave had already subsided. We had low levels of transmission when our fourth wave started. their Omicron wave started at very high rates of Delta transmission. So they were already at capacity in their hospitals because of admissions for Delta when Omicron hit. And so they had this double whammy of infection from both variants. And remember also that many of those countries are in their winter season. And so then you always see hospitalization in the winter season for other infectious disease, other respiratory pathogens, flu as well. That's a difference with South Africa and the UK and Europe and the US. We started our Omicron wave at very low levels of Delta. Our Omicron wave was in the summer. Those are some of the differences that might explain why their health system is hugely affected right now compared to ours.
So obviously they had two variants that they had to cope with, and you also mentioned winter. So what is it about winter that makes Omicron spread faster? Is it just the way that we socialize because we're more indoors, or is there something about the SARS-CoV-2 virus that makes it spread faster?
I think all respiratory infections have a increased prevalence during the winter seasons, particularly influenza, and we see more hospitalizations during the winter months. And that's because, as you say, it's the way that we socialize, we stay indoors, we keep windows closed, and so there's more transmission of respiratory infections that way. Most countries see a spike or an increase in hospitalizations from respiratory infections in winter.
So there's nothing specifically about the virus that makes it spread?
There's nothing that we know about SARS-CoV-2 that shows any seasonal affinity. And so we've had waves in summer and winter. We've had variants emerge in summer and winter in our country, in many other countries. So I think there just seems to be the cyclical emergence of a variant that causes a wave, irrespective of the season. At the moment, we don't really know or think that there's more transmission the virus itself causes in winter months compared to summer months.
The big question that people ask out there is, are we going to have a booster each year, or what is it likely to turn out like? And I know it's hard to determine because we don't yet know how long a booster lasts for, but is there talk in the science world about what's the most likely scenario?
I think the evidence does show that there is some waning of protection after 6 months of a Pfizer vaccine and, maybe after 3 months of a J&J vaccine. And that's why the decision has been taken in South Africa and many countries that, people would need a booster dose. Also, we know that, when new variants emerge, some of them evade immunity. And so protection lessens because of the new variants. And so we have no way to predict what the future holds, whether the next variant is more transmissible or more severe. I think it's something that we can't speculate right now. But what we do know is that if protection from vaccination and prior infection does wane, it does seem likely that possibly an annual booster, similar to what we do with the flu vaccine, might be needed. At the rate that we're going at the moment, it does seem likely that an annual vaccine strategy may be something we would see for the next few years or until COVID gets to sort of endemic levels.
What's the difference between this and our childhood vaccines? For childhood vaccines, you get many boosters. Why do those boosters last for lifelong, and why are you saying that this one could likely be an annual booster?
I think each virus is a little bit different, and the way that the vaccines are developed and how they are targeted to your cells are a little bit different. And some vaccines just are able to confer lifelong immunity and some aren't. Particularly with HIV, there's been many, many years of development trying to develop an HIV vaccine. But because of the mutations, the immunity just does not last, and we still are away from getting a vaccine. And I think similarly with the COVID-19 vaccine, because of mutations and because of waning immunity, boosters are required, similar to some childhood vaccines. After a primary series and 1 or 2 boosters, that seems to be enough. I think it's just not something that we know for sure how many doses will be enough to confer protection and for how long.
And lastly, is there any indication of when the Omicron wave would end in South Africa?
I think all indications are that cases have declined in every province. Gauteng is already exiting the 4th wave. Gauteng, that started first and peaked earliest, has already met the criteria for the end of the wave. And I think all the other provinces will follow quite quick. But I think we do anticipate in the next 2 to 3 weeks we would see an end to the wave.
That was Dr. Waasila Jassat from the National Institute for Communicable Diseases. As I mentioned at the beginning of this podcast, we will be doing Bhekisisa podcasts from time to time to talk to experts who can help us to break down COVID or general health or social justice issues that might be confusing or just a little bit hard to understand. If you have suggestions of issues you'd like such experts to explain, please do email us on health@bhekisisa.org. We will be so happy to hear from you. That's goodbye from me, Mia Malan, and the Bhekisisa team. Until our next podcast episode.
This was a Bhekisisa podcast.